Great. Good afternoon, everyone. And thank you for joining us today to learn about Aspire and the purpose-driven job opportunities that we have at Aspire. Next slide, please, Dan. My name is Sharon Lawrence, and I'm the Chief People Officer. And today I'm going to take you through some information about Aspire, and two of my colleagues are joining me today as well. Barb and Vanessa both are recruiters for Aspire, so we have a lot to share about our opportunities. So Aspire's vision is to create a community where people of all abilities live, learn, and grow together. Very aspirational vision, and you can tell by the picture there, we're very proud of the work we do. We love the work we do and the people we do it with. Our focus is really on inclusion and redefining what's possible for people with disabilities. Next slide. In Chicago and the nation, Aspire's been voted over the past 6 years in a row to be one of the best and brightest companies to work for. We're very proud of that, and all of our team members in the organization fill out a survey every year that enables us to win this. So we work very, very hard to achieve this stature every year. We were founded in 1960, so we've been around for many, many years. And this past year, actually, we joined forces with North Point Resources, which is up in Zion and Lake County, and really doubled our size, which is really, really exciting. And that's really where the Together We're Better mantra comes from, which you'll hear a lot when we talk about Aspire. So what do we do at Aspire? Aspire is made up of a number of different business units, one being our community homes. We have 23 community homes across Lake County and Cook County, and these are residential homes and neighborhoods like we all live in, and we have people with disabilities that live in these homes, and they're cared for around the clock by team members that work for Aspire. We also have day programs, one in Lake County and one in Cook County. And these programs provide opportunities for people with disabilities in the community, as well as within our community homes, to come together, interact with other people, live, learn, and grow every single day. We also have a career academy that's located in Hillside, and our career academy is really designed to focus on 8 different industries where people with disabilities can learn the skills, knowledge, and abilities to perform job functions in those industries, so we can enable them to find a job and feel included in the community doing work just like you and I all do. We also have social enterprises. We have an Art 360s program, and the Art 360 program enables us to work with artists that are people with disabilities, and we help promote and sell their art through social media, as well as partnering with local employers in the community who buy the art for their corporate offices, which is really, really exciting. We also partner with Metropolis Coffee, who's a coffee roaster in Chicago, and we actually package Aspire coffee, and our people with disabilities work and do those tasks to do the coffee packaging. So really, really exciting work across the spectrum. In supporting those different business groups, we have support partners. So we have people who work in human resources, we have finance and facilities, IT, and philanthropy. So what's in it for you, and why should you join Aspire? At Aspire, I think the people who are most successful have a strong sense of purpose and mission. They want to get up every morning and feel like they're helping others, which is very fulfilling for them as individuals. So you can really make a difference in the lives of others every single day by working with people with disabilities to help them achieve their dreams and desires, just like you and I all have. We also help adults with disabilities, as I mentioned earlier, as I talked about the Career Academy, really develop skills to help them have employment opportunities and feel included in the community. Also, it's that personal satisfaction that we each are able to achieve through this kind of work of really caring for others in a very supportive and inclusive environment. So what are those success characteristics that set us apart and really enable somebody to be successful at Aspire? There are a number of them. First and foremost is integrity. And that really means doing the right thing at the right times all the time. really having a sense of caring for others, whether it's a team member or the people with disabilities that we're supporting and serving. Someone who's an effective communicator, obviously working with people with disabilities, there's a lot of different communication challenges. So being respectful and making sure you're adopting the effective communication style that's going to be most effective for that individual. Someone who's got a positive attitude that gets up every day and it's a new day and positive, wonderful things are going to happen. And then someone with a strong work ethic. This work is hard and it's not for everybody, but it's very, very rewarding. And again, you work in a very supportive environment with other people who have that same sense of purpose and mission that you do. So what are the job opportunities at Aspire? I'm going to turn it over to my colleague Barb, who's going to take you through what the team leader role is and a direct support professional. So Barb, I'll hand it over to you.
Next slide. Thank you, Sharon. So the first position is the team leader position. The team leader oversees the group home and manages the home budget and household funds and replenish whatever is needed for the home. The team leader also coordinates the direct services in the home and work alongside the case manager on all daily basis, ensure services to the individuals are provided according to the individual's plans. The team leader also supervises the direct support professionals by monitoring performance and providing coaching as needed, and has open lines of communication to ensure a safe, healthy, and comfortable home environment where each person thrives and independence is promoted by making sure person-centered plans are carried out and goals are tracked and individuals have access to explore opportunities and choices safely. The team leader also promotes a sense of community engagement, work in partnerships with the families and friends and Aspire team members and other members of their support team. They respond to unique needs and dreams of each individual so that a meaningful life experience can be realized. They respond to medical and behavior crisis and provide support to the team, making sure the shifts are covered to meet the operation needs of the home. The team leader makes sure that the home runs smoothly. So the qualifications for a team leader is a high school diploma or equivalent, a minimum of 1 year experience supporting persons with intellectual and developmental disabilities, a valid driver's license in good standing, and the minimum age of 21, and able to have oral and written communication skills and ability to write reports. So the team leader also, we ask that you work flexible hours, days, including some holidays. Next slide. So this is like my favorite position, the direct support professional. So the direct support professional works directly with the individuals with developmental disabilities, providing companionship and also, working as a role model because these guys do look up to you. So setting by example is my key. So assisting with everyday life skills, assisting with grocery shopping, cooking, cleaning, hygiene, laundry, or just sitting down having a conversation, asking how your day went. And also advocating in and out of the community and making sure that all is treated with dignity and respect. So some of our openings that we currently have are in Lake County, Zion, Gurney Beach Park, Grace Lake, Winthrop Harbor, full and part-time positions. And also in Cook County in the western suburbs, we have Bellwood, Maywood, Franklin Park, LaGrange, Brookfield, Westchester, Hillside, and Berkeley. So please do apply. Next slide, please. So the qualifications for the direct support professional. What is required is a high school diploma or GED, a valid driver's license in good standing. That is also required, a minimum age of 21, an attitude of respect for people with developmental disabilities, and a high degree of professionalism and effective communication and attention to details is required. What is preferred is 1 year of experience working with adults with developmental disabilities. And Sharon's going to talk about that later on because there is paid training, so we don't just throw you in. We make sure that you are trained before, coming into the house and during your first days. Next slide, please. So right now, supporting those that we serve, let's watch a video before we go to our other openings. This is Paul's story. Paul is an individual who's been with Aspire for about 6 years, and he's going to talk to you about living at Aspire. Video, please.
Give me one moment, just got to get it shared. We'll be good to go.
So when I first heard about Paul, I was told that he was living in a nursing home.
My anxiety was not great. It was very stressful. People fighting, just drama. I needed to get out of there and move into a place to where I would feel comfortable.
I was beyond belief of why this young gentleman was living in a nursing home. And I couldn't help but think to myself, what kind of future will he have? What kind of living environment is this for this young man that could really have so much more for his life?
My mom found out about Aspire, I guess, by going online and making calls and doing all the research. And when she told me about it, I just had a big smile on my face and said, you know, let's go see what this is all about.
So after a few visits and after a few phone calls with Paul's parents, they did decide to choose Aspire.
Everybody was very polite and respectful. They respected my space. They respected my boundaries. You know, they welcomed me with open arms.
Paul was so determined to work. So he advocated for himself throughout his community to find a job that he truly enjoyed.
I think it was near the end of my tenure at Mike's Meat Market in 2016, and I landed another job. Working 2 days a week wasn't really my calling. I wanted to be to where I was working at least maybe 3 to 5 days, and now I'm working 5 days a week, sometimes more.
And more recently, his peers have nominated him as the president of their advocacy group. And Paul has developed a phenomenal voice for himself and for the individuals of Aspire. We are all about making sure that people are included in their communities. And there is no better way than with all of our community homes being embedded within their community through the support of their team, their peers, their neighbors, and when we all come together, we truly achieve greatness for the individuals at Aspire.
It's amazing. I couldn't be more thankful for the people that work here. I'm just blessed to have great friends, great housemates, roommates. They support me with a lot of the things that I do in the community. These people that either work or live in Aspire, they're not like friends to me, they're like family.
The individuals that we see every day are trying to reach the same dreams and desires that you and I do.
Aspire means so much to me. It's changed my life completely. My future goal is to move into my own apartment, and I hope to come back to Aspire maybe either to volunteer or work a part-time position, maybe here at one of the homes, helping out the staff with the residents, especially this house here at Forest Park, because this house is just, it's special. And I would love to come back and play a huge role in Aspire in the future. You got it?
That was great. Next clip, please. Next clip. Okay, so right now we're going to have my colleague Vanessa. She's going to talk about the other openings that we have. So, hey, Vanessa.
Hey. So I guess our first opening that we have is our case manager. So what they do is that they ensure all aspects of each individual's program is implemented, coordinated, and monitored to meet our mission. They communicate and work closely with each person's team in order to have seamless service delivery that results in positive outcomes. We are looking for someone that has genuine interest working with people with disabilities or in the nonprofit world. We do train for certificates such as QIDP and do hands-on training. Also, we are looking for someone that enjoys working in a team environment. Since this role, they'll be collaborating with a lot of other staff members as well. And then going into our health advocate role, oops, sorry, it was still on the other slide. The health advocate role, what they do is that they coordinate the healthcare appointments and transportation for participants using Aspire's residential services, and they act as a medical liaison and health specialist to the participants. They also assist in the pickup and drop off of prescriptions from the pharmacy and delivery of the medication to the residential sites as required. They also pick up medical supplies from the distributors and delivery of medical supplies to the residential sites as required. They do maintain monthly calendar for all medical appointments and then maintain the health records for all persons who use our residential services. And then next slide. And then our facilitator, what it entails is that they create customized curriculums based off of the individual's strengths and needs. So they prepare lesson plans and training schedules. They also provide coaching and guidance to the direct support team members in the delivery of activities. They develop plans and recommendations for individual person-centered plans that meet individual interests, dreams, skills, strengths, and areas of needed skill development. They assess each individual biannually on hard and soft skills. That way they're able to track areas of growth and areas of need. They ensure proper record documentation by completing and monitoring individuals' goal tracking as well. And then going into our maintenance assistant role, what they do is that they perform day-to-day maintenance functions in both our Cook and Lake County locations. They coordinate with the maintenance manager to assist in maintaining, repairing, and improving the facilities of Aspire. They perform building maintenance, which does include light carpentry, painting, minor electrical repairs, and basic plumbing at community homes and our commercial buildings as well. They also respond to emergency calls for maintenance and repairs and any troubleshooting issues. And then next slide. And then going into our behavior therapist role, they collaborate with a team to provide applied behavior analysts, assessments, and clinical services to individuals with intellectual and developmental disabilities in the agency, home, and community settings. They schedule and conduct monthly behavior meetings with case managers to discuss progress, program implementation, and collaboration with the parents as well. They assist in the development of the person-centered plan, including completing assessments used for plan development and developing goals and objectives to meet individual outcomes and support where is needed. They also develop behavior support programs and present the programs to the Behavior Support and Human Rights Committee. Next slide.
So we're going to transition now to talk a little bit about team member benefits. So as Barb mentioned earlier, we do offer paid training for a number of our positions, and the specific role she was talking about, our direct support professional. When somebody is hired into Aspire into that role, there is some online training that you complete for the first week of your employment. That's through our online learning management system, Relias. We also have in-person skill development training to enable you to have the certifications required to work in our homes, and that's CPR, first aid training. Our direct support professionals often have to also administer medication to people who live in the homes. So we need to make sure that you have that capability and that training. And then also there's training associated with behavior management, because some of our residents that live in our homes, because of their disability, there's some behavior challenges sometimes. So knowing how to interact with people and work through those kinds of challenges is really important for all of us to have those skill sets. So we also have that training. And then also there's on-the-job training that also enables you to become a certified direct support professional. So all of that is offered and paid for Aspire. We also have the traditional benefit programs and plans that you would expect to see at most organizations. We've got medical, dental, we have vision. Our retirement plan is a 403B plan, and we also have short-term and long-term disability. We also have a generous paid time off program. We've got vacation, personal days, sick time, and holidays. So my hope is you've heard a lot of exciting things about Aspire today and what it would be like working at Aspire. And again, if you're into purpose, you're into mission, helping and caring for people every single day, Aspire is the place for you. You can take a look at our website to look at the jobs that Vanessa and Barb has shared with you today. And there's other jobs posted on our site as well. And that walks you through how to apply. And then Barb and Vanessa will follow up with you so you can learn more and we can learn more about you. So I'm going to pause now and we can answer any questions that any of you might have of us today. And thank you again for participating. We're delighted you joined us today.
Excellent. Thank you all for your presentation. That was fantastic. And again, if you guys have any questions for the Aspire of Illinois team here, please feel free to enter those into the chat section and we will relay those questions to the ladies at Aspire to get answered. In the meantime, I'll go ahead and just ask you guys just a few generalized questions to give the folks that are on the webinar today a little bit more background information before they apply. Is that okay?
Sure.
Excellent. Can you guys elaborate a little bit more on how long your process typically takes as far as hiring is concerned? So, for instance, when an individual submits an application to the point of which they're being hired, how long will that take?
And I think it probably varies on position, but Barb, I'll go ahead and start with you so you can talk a little bit about the DSP role.
Yes, so the DSP role, so after we decide and an offer is made, I normally send employment verification forms to you and you submit them back to me. You know, you can submit them through email or just taking a screenshot, as long as I, get that information back. So we will follow up with you within 24 days once that employment verification form has been submitted to me. And then our HR specialist, within 24 hours, she'll get in contact with you and send you that information. And then I think it takes about a week, but it all depends on how quick we can get your information back.
And Vanessa, do you want to comment on some of the jobs that you do recruiting for? How long it takes?
Yeah, so definitely it depends if your resume is already on there. Usually I contact them within a couple of hours once I see all of that information. But I would say usually it takes a week as well to get back with a decision if we're going to move forward or not.
Excellent. Thank you, ladies. And I actually did have a question from somebody in the webinar with us. This individual asked, it seems like you may need a certification for the maintenance job.
So not necessarily. So it's kind of preferred if you have a certificate in HVAC or electrical, but definitely it's not a requirement to have a certification. But if you do have one, that's a plus, and definitely that does affect the pay as well.
Excellent, thank you. And kind of expanding off of that question, actually, could you guys elaborate? Do you have any sort of educational requirements that are necessary to apply for the jobs that you posted here today? For instance, a GED or a high school diploma?
So Barb, do you want to start?
Yes. Yes, so for the direct support professional, a GED is required or a high school diploma is required. For the team leader position, the same as well.
And then, yes, for all the jobs I listed off as well, you need a GED or high school diploma as well.
Excellent, thank you guys. And do you conduct background checks to get hired with your organization?
We do.
Can you kind of elaborate on what that process would look like for a prospective applicant?
Yeah, so, obviously the type of industry that we're in, we do fingerprinting as a part of the background check process. And we actually have 9 different background checks that we do to make sure that the person can work in our environment, because we're held to very high standards through the state of Illinois. And so we go through that process very quickly though, but there are about 9 different background checks that we do.
Excellent, thank you. And I know a question that we get quite frequently, especially now during the current state of the world, is how are you all handling COVID safety precautions? Are you providing PPE for the individuals who work for you? Are you suggesting that folks maintain social distancing requirements, so on and so forth?
Great question, and I'm so glad you asked it, and I should have brought it up in our presentation. Ever since COVID struck back in March, we've had a huge responsibility to keep our residents and all of our team members safe during this time. Because of the work we do, we're considered frontline healthcare essential workers, and so our team members came to work every single day. I'm sure some very scared about catching the virus. And we have PPE across the entire system. We have regimented cleaning, disinfecting that goes on every single day by team members, as well as professional cleaning services that come in. We have screening stations when you enter our facilities, where you need to take your temperature and answer a whole list of questions to make sure that you can proceed to your workstation. The majority of people are still working from home, but in July, we started coming back 1 day a week, just because we know together we're better. But right now, the majority of our staff outside the community homes are still working from home. But yes, safety is our #1 priority, keeping our residents safe and all of our team members safe. So glad you asked that question, Daniel.
Excellent, thank you. And actually, kind of in regards to that same question, we had an individual that had asked how many people are in one of the houses at one time. So I think kind of what they're trying to gauge is, how many individuals can they expect to possibly come in contact with during any given day. And I'm sure that's going to vary based off of whatever position it is that they end up being hired for.
Right, so Barb, why don't you take that one, since you're very familiar with the community homes?
Yeah, so there are between 6 to 8 individuals that reside in each home. We are very careful far as anybody catching anything. Right now, I'm going to go back to the COVID-19, because we also, we have limited, well, there's no visitation right now in the homes. And also we have no cases of coronavirus in the home. So our individuals are communicating with their guardians or friends through FaceTime or through Duo or Zoom or, something like that. But there's no visitation far as the houses go. So the houses are clean, they're safe, and and we want to keep it that way. So it's between 6 to 8 residents that reside in the group homes.
And if I can just add to that, from a staffing perspective, there's usually 1 or 2 per shift, and we are round the clock shifts. So we have 3 shifts that we need to staff in each one of our homes. And prior to COVID, we would have staff sometimes go to another home to help fill in a shift or help out. That has really ceased during COVID as well, because we have not wanted people working outside the home and interacting with other people outside than their little universe that they're coming and going from every single day. Again, in an effort to keep everybody safe and everybody healthy during this time. And to Barb's point that she made, we don't have any cases of COVID. I want to knock on wood, because I feel every time I say that I'm challenging fate. But again, it's because we've been very, very diligent, and we have the responsibility to care for somebody's son, daughter, brother, sister. And so it's a huge responsibility we take very, very seriously.
Thank you for your thorough response, guys. Another question that I get quite frequently, applicants kind of want to know what like typical work attire would be for a given day at your organization.
So Barb, do you want to talk about the attire that our team members have in the homes?
Yeah, so are you referring to what open positions that we have in the group homes? What open positions that we have? What hours we have?
Yes, for the open positions that you discussed here today.
Yes,
And I'm sure
yes.
that could vary. So
Yeah, so we have a variety. We have weekends, we have first shift, maybe a 7 to 3 part-time, Saturday and Sundays. We may have a Monday through Friday, maybe 3 to 11 or 3 to 9. And we also have overnights, which are 11 p.m. to maybe 7 or 9 a.m.
Vanessa, do you want to talk about the positions you support, what the hours are?
Yeah, so most of them are kind of, Monday through Friday between 9 to 5, 8 to 4. The life consultant role is going to be more of an on-call, which is pretty flexible, kind of depending. You do have to answer some calls after hours as well, but it does depend. But that's mostly hours.
excellent. And another question that I get frequently is, are there any sort of restrictions on things such as tattoos, hair color, piercings, and then kind of working off of that, if you could also kind of describe what an individual would be expected to wear on a given day?
Well, I can speak on the part far as the group homes. The group homes we're looking for is somebody who has the compassion, the integrity, that wants to work with adults with developmental disabilities, who are a good listener. And far as we don't care about the tattoos. You are who you are. And our individuals with developmental disabilities are who they are. As long as it's not stopping you from completing your task, we're okay with that. And then as far as the dress code, something comfortable. Maybe a pair of jeans and t-shirt, gym shoes. You want to be comfortable. So, yeah, just comfortable clothing.
And I'll just add to that, at Aspire, it's really about a culture of inclusion for all of our residents, because we have community homes that are in neighborhoods like we live. We want our residents to be involved in what's going on in the community, and we're a very inclusive environment. So to Barb's point, you be you, me, I'll be me. And we want people to be their true self at work. And so that's really important to us, the whole diversity and inclusion element. So Vanessa, do you want to talk about anything different from the jobs that you fill? Is there anything different you would add?
Not really. I mean, the same, like when I'm looking for a candidate, I really want someone that, is here for the right reasons, and they do have a genuine interest, working for the company and with our mission as well.
Excellent, thank you. And I actually do have another question from somebody in the webinar with us. They are just kind of interested in what the pay scales would be for each of these respective positions that you discussed here today.
Okay. Anybody want to take this first? You want me to take it? Okay, I'll take it.
You go first.
All right, so for the direct support professional position, the start pay is $13.02 an hour. So, and that also includes whether you full-time or part-time. It includes those benefits that Sharon also talked about. The team leader position, that pay is a starting pay of $37,400 a year.
And then for the positions I went over, so for the case manager role, that one does start off at $37,440 a year. The health advocate does start off at $13 an hour. The facilitator, it is a range, kind of depending. So if you do have those certificates, then that range is a little higher, but it kind of depends. For that one, it is starting at $18 an hour, and then with the certificates, it can be a little more. And then with the facilitator role, that one is $15.50 an hour. And then the behavior therapist is a range depending on experience, but it is starting at $17 an hour.
Excellent. Thank you, ladies. Can you also kind of just briefly describe, like what kind of opportunities for advancement there might be within your organization? And then kind of another element of that, perhaps you might be able to share, some success stories of individuals who have been hired there.
Want me to take that? Okay, so there is room for growth and aspire. I have hired DSPs that are now either facilitators or either case managers. And that is because of their education background. And I can use myself as a success story. So years ago, 9.5 years ago, I started out as a direct support professional. And I, within 3 months, applied myself and became a team leader. And from a team leader to an operations manager and now a recruiting manager. So there is room for growth as long as you apply yourself or if you have the education to back yourself up.
And I would just add to that too, Daniel. I'm fairly new to Aspire. I joined Aspire 6 months ago because I wanted to work for an organization that truly valued people and to work in an environment where that sense of purpose and mission resonated every single day. So that's what brought me here. But I think that's one of the things that I'm going to be focused on as the Chief People Officer, working with all of our leaders to make sure that our leaders have the capabilities to develop the folks that are on their team that report to them so that we are better coaches, that we're better mentors. And so that will be all unfolding as we go forward. We're going to have lots of new opportunities for people to develop and grow as we build these different programs. But to Barb's point, I think, if somebody wants to grow, they just need to make somebody aware that they want to do something different. And, I'll make the personal commitment. We're always going to try to figure out how to make that happen because we want people to stay and we want people to grow and be happy. And if they're happy, our participants are going to be happy and we're going to just do better as a business.
Excellent. Thank you. And then, a lot of individuals during this COVID pandemic also have asked, do you guys have any options for working remotely?
We do, and right now, the majority of the staff is working remotely, except those people who are supporting those that live in the home. So everybody else is remote right now. And I think we're going in about 1 day a week into the offices.
Excellent. Thank you. One last question that I would like to ask you guys would be, how can a candidate stand out and get an interview assuming they are qualified for the position they are applying for?
Well, I think Barb and Vanessa are going to follow up with everybody who participated on the call today, but you can certainly go to our website and apply, but I know they're going to probably catch you even before you get to do that. They're going to be very anxious to talk to anybody who joined us today and learn more about you and how you can contribute to Aspire.
You apply, we will contact you.
Yes.
Your application, submit your, attach your resume, submit your application. You'll be called within hours. So don't worry about that. We will get to you.
Excellent. Thank you. And I actually do have a question from somebody on the webinar. They asked, where are job locations such as facilitator, team leader, and they said facilitator again. So facilitator and team leader, where are those located at?
Yeah, so for the facilitator role, we do have a few openings. So some are in our Cook County area, and then some are in our Lake County. So those are going to be in Hillside, Illinois, and then in Zion, Illinois. So
And the
if
team leaders.
Oh, and then team leaders as well. They're both in both Cook and Lake County in those cities.
I think all 3 team leaders right now are in Lake County though, Vanessa.
Yes.
Okay, I believe they are.
Okay. Yep. Sorry. Yes, all in Lake.
Excellent, thank you. Again, I just want to reiterate to everyone that's on the webinar, if you have any questions for the Aspire of Illinois team, you can go ahead and enter those questions into the chat section, and I will make sure to relay those questions to them to get answered. I also do want to reiterate as well, I have posted contact information for both Barbara and Vanessa. I have posted their emails in the chat section. I know Barbara's contact information is also included on the Aspire of Illinois workNet employer booth as well. I have also posted a link to that employer booth in the chat section for anyone that wants to follow up with further information there. At that location, you will also be able to access links to the employer website as well as links to the respective job openings that they have. We do not have any other questions, ladies, so if there's any sort of summary statements or closing remarks that you guys would like to make, you can go ahead and do so now.
I would just again like to reiterate my gratitude for everybody joining us today and taking the time to learn about Aspire and our openings. I'd encourage you to apply and to reach out to Barb and Vanessa to learn more about the opportunities. And thank you, and hope to see you at Aspire.
And again, I just want to thank everyone again for attending the virtual job fair today. As I previously stated, you can find their employer booth on the Illinois workNet virtual job fair page. I have also recorded this webinar, so a posting of this will also be included on their employer booth page as well as the Illinois workNet YouTube channel as well. Thank you so much, ladies, for your participation today.
Thank you, Daniel.
Thank you.
Thank you.
Take care.
Bye-bye.
Thank you. Bye.